So I'm going to use your comment as an example because it represents like hundreds that I've seen like this. But like, you guys don't know what you're talking about. You're super triggered and emotional. You don't know what nurses and doctors do, and you're obsessed with the idea of diagnoses. Here's the thing. We don't treat diagnoses. We treat the patient. We treat the signs and symptoms. And how do we do that? We make a clinical assessment based on how the patient's presenting. How are their vital signs? What are they looking at? Oh, they have 3+ pitting edema. Shit, we better pay attention to their heart and their cardiac function and their renal function, right? We don't need a chart for that, and we don't need a diagnosis. We're treating the patient. We're not treating the diagnoses. And doctors don't just sit around and diagnose patients. They treat patients. Sometimes we could have a patient for days or weeks before we had a formal diagnosis, but we're still treating them. And then you guys are really obsessed with the idea of like, you can't make those statements because you haven't seen the patient's chart and you're not the doctor caring for them. Well, how do you think we do emergency medicine? We're not the doctors that care for them when they come into the ED at 2 a.m. We don't have their history. We don't have their charts, but we treat the patient. So you guys don't know what you're talking about. It's embarrassing. It's tiring. It's a little bit maddening because like, you're in my house now, right? I'm a nurse and I'm a proud nurse. And I really am kind of upset that you guys are just disregarding, especially some of these clinicians, like nurses with 20 years of cardiac nursing. You're not going to listen to them? Are you kidding me? There's a hospice nurse on here. Like, she knows what she's talking about, and you guys are going to ignore that? Who do you think the doctors listen to? What do you think the doctor does in the morning before they do rounds? They go and they look at the chart to read what the nurses have charted. Do you understand that? Anyway, I'm tired. You guys have exhausted me, so class dismissed.